We will talk about generalized anxiety disorder. What you should know about generalized anxiety disorder, anxiety disorders, and what are the other common anxiety disorders, like for example, panic disorders. So first, we will discuss anxiety disorders. Anxiety is one of the most common mental disorders worldwide, not only in the Philippines. So it can be like, for example, if depression is the number one, anxiety would be the second. So anxiety can also have depression. Okay? So what is generalized anxiety disorder? Usually, if we base it on DSM-5, there are a lot of criteria to be considered. So it must be at least 6 months of continued symptoms, or it started 6 months ago and it continued that you have chronic worrying or difficulty controlling your worries, and at least 3 symptoms from easy fatigability, like madali kang mapagod even though you have less physical activities because you have a lot of things in mind. Then next is difficulty sleeping. You can also be irritable. You can also have muscle tensions, no? Aside from mental tension, like you feel at edge, no? You have this, what we call easy distractibility, aside from sleep disturbance. That's according to DSM-5. So there are no other mental disorders that are actually fit with your signs and symptoms. There is no medical conditions. So other factors or other criteria based on ICD-10 would be at least one of the 4 symptoms from heart palpitations or increased heart rate, heart pounding. Next would be increased sweating, dryness of mouth. And then so those are the symptoms. And then other symptoms would be chest pain, difficulty breathing, also trembling or shaking. Next would be stomach discomfort. Also, those criteria I have mentioned in DSM-5 are actually included in ICD-10. So these are the symptoms, and there are no medical conditions. But if you consider medical conditions, it would be the range laboratories from your thyroid panel tests, like increase of your T3 and T4 due to hyperthyroidism. So it can also have manifestations of what we call anxiety disorders. But you have other conditions, like for hyperthyroidism, you have increased digestion, you can have diarrhea, you also have difficulty in you cannot tolerate the heat. Okay, if it's like, for example, last summer you have difficulty in kumbaga mag-adjust dun sa heat, no? Unlike sa iba, naging okay na sila, tapos ikaw parang mainit pa, sobrang mainit pa yung pakiramdam mo. Okay? So there are a lot of conditions for hyperthyroidism. So you must also seek the help of endocrinologist for considering hyperthyroidism. Okay, other symptoms, of course, it can also, like for example, it can overlap with panic disorder. Unlike with panic disorder, you don't have that chronic worrying for 6 months. You can have panic disorder for at least 1 week. If you have experienced panic disorder, like feeling mo inatake ka sa puso, nag-heart pounding ka, chest pain, feeling of choking, stomach discomfort, sweating, feeling of numbness. But you also have the fear of dying or impending doom, or fear of getting getting crazy, or you cannot control a lot of things. Okay, at times there are personality disorders that is related to anxiety disorder. For example, OCD. OCD is obsessive compulsive disorder. It's different from obsessive compulsive personality disorder, wherein obsessive compulsive personality disorder, they are the ones who are perfectionists. When we say OCD, obsessive compulsive disorder, you have those obsessive thoughts about, for example, cleanliness, okay? Pwede rin mga obsessive thoughts about harming other people. So, may obsessive thoughts. And then, you do something or you have behavioral change. You do something in order to relieve from that obsessive thoughts. Like, you clean the area if you think it's dirty, and you always have that routine. You have to wash your hands always. You have to use alcohol. But those who have OCD can last from like doing those cleaning behavior for like 30 minutes to hours. Okay, it can actually affect the relationship. So OCD can also have generalized anxiety disorder. So what is the cause of generalized anxiety disorder? Usually they can also have, like, for example, depression, no? They have imbalances of neurotransmitters. But this time, there is increased, for example, increased serotonin, increased norepinephrine, something like that. So, more it's increased. And then, factors like, in social theory, very strict parenting, or anxious parents can have anxious children. And then, other factors can be environmental, wherein there are demanding co-workers, or it's very for you, the environment is harmful, or it's very demanding that you cannot keep up with it, or you think you will fail, something like that. So how can you differentiate normal anxiety to generalized anxiety disorder? Of course, with normal anxiety, after the exam, after the presentation, those anxiety will go away. But with generalized anxiety, it still continues. No, it doesn't resolve with sleep, or you actually have difficulty sleeping with generalized anxiety. So it affects your life. There is dysfunction, okay, with your relationship, with your family, with your relatives, with your romantic relationship, and your work. Okay, your coworker at times can say that maarte, or you have a lot of complaints, something like that. But it's just because you have generalized anxiety disorder, chronic worrying. Okay, you can stop. You worry about your house. You worry about a lot of things. Anything can actually make you worry with generalized. That's why it's called generalized. Okay, so aside from those management with alternative ways like relaxation activities, breathing meditation, relaxation activities like yoga, tai chi, aromatherapy can also help. Okay, aromatherapy with lavender and other aromatherapy essential oils available. Okay, so we also encourage, for those who have severe anxiety, using the HAM-A or GAD-7 scoring or scale. We give them anti-anxiety. So usually combination of anti-anxiety and also those with medications that can make you calm, like escitalopram plus alprazolam. So the medication can last from 6 months to 1 year. So it depends on the severity of your generalized anxiety. So I hope you learned from this discussion. Okay, this is about anxiety disorders. And be informed. Please share this information.